Hello, and welcome to 5 Minute Videos review for the NCE. This is this video is going to be covering Domain 2, Intake Assessment and Diagnosis, and today we are going to be going over Subcategory D, which states conduct a initial interview. So what is an initial interview? Sometimes it's also known as an intake interview. The initial interview is a getting to know the client. And what I mean by that is there's really an art to an initial interview. You want to have those core conditions, not just be robotic or not just have a paper in front of you and checking off boxes. The core conditions were part of Dr. Rogers' theory of person-centered, and that involves empathy, which is attempting to understand what a client is going through. Congruence is the notion of being genuine, not putting a front, not being fake. And then unconditional positive regard, that is, I accept you regardless of your mistakes, who you are, your beliefs, you are still going to be accepted. So when people talk about establishing those, that really needs to be the moment you meet the client. And then what I tell supervisees is paperwork comes secondary, especially in a intake or in an initial interview. Because if you do not establish rapport, that client will not trust. And if they don't trust, then that is 50% of counseling outcomes. So that is the first priority that as a counselor, I would say, has to be established are those core conditions. And that's why I say, paperwork is secondary. Checking off the boxes, that can come at a later time if needed, but first it's about building those conditions so that the client feels heard, feels understood, feels like this is someone that could assist in whatever goals that they have or whatever problems that they are sharing. So again, it's an art. It's something that takes a great deal of practice. And then some initial interview questions could be to explain some symptoms. So if the client is saying, "Oh well, I don't sleep well," well, what does that look like? How many hours of sleep are you getting? What is the pattern? How long has the pattern been going through? Those types of details you would want. Also, in an initial interview is understanding someone's life history. So things like doing a timeline, creating kind of a glance of their developmental milestones. Also family history, and then understanding some risks if they are engaging in risky behaviors. What are some risks that could really harm the client? So part of an intake interview is looking at all those things. But again, to me, it's about establishing those core conditions that Carl Rogers preached. And he even went to say, individuals heal naturally. What they need is they need those core conditions to be there so that they can start the healing process.